In September 2023, there was an outbreak of the deadly Nipah virus in Kerala, India. 5 people have caught the virus, 2 of whom have died. This is the 4th Nipah virus outbreak in Kerala. The most deadly was in 2018, with 18 laboratory-confirmed cases and 5 suspected cases, 17 of whom died. Nipah virus infection is a relatively newly discovered disease of swine and humans caused by infection with a novel paramyxovirus termed Nipah virus. This disease emerged in Malaysia in 1998 and 1999. It was linked to severe encephalitis among people occupationally exposed to infected pigs in Malaysia and Singapore. The disease was eradicated from the national commercial swine population by control efforts. A number of fruit bats of the genus Pteropus seem to be reservoirs of the virus in Asia, and has since been reported in other countries in Asia and Africa. Nipah virus is a highly contagious virus that can cause severe encephalitis, inflammation of the brain, in both pigs and humans. The outbreak in humans in Malaysia and Singapore followed contact with infected swine, resulted in encephalitis, with until 40% mortality rate. In 2014, an outbreak of Nipah virus infections occurred in horses and humans in Mindanao in the southern Philippines. The proportion of Nipah virus infections that are asymptomatic varies from one outbreak to another and ranges from 17% to 45%. Nipah virus is transmitted from bats to pigs, and from pigs to humans. Bats are the natural reservoir of the virus, and they can shed the virus in their saliva, urine, and feces. Pigs become infected when they come into contact with contaminated bat droppings, saliva, or urine. Humans can become infected when they come into contact with infected pigs, or with contaminated objects or surfaces. The risk of person-to-person transmission and documented cases of healthcare workers being affected during outbreaks has left the medical community perplexed. Human-to-human and nosocomial transmission was also documented in the Indo-Bangladesh outbreaks. In the Siliguri outbreak of 2001, a single patient admitted to a private hospital infected 23 hospital staff and 8 visitors. In pigs, Nipah virus infection can cause a variety of clinical signs, including fever, cough, respiratory distress, neurological signs, such as tremors, seizures, and coma. In humans, Nipah virus infection can cause a variety of clinical signs, including fever, headache, muscle aches, cough, sore throat, nausea and vomiting, diarrhea, neurological signs, such as confusion, seizures, and coma. There is no specific treatment for Nipah virus infection for swine. For human, treatment is supportive and human patients required intensive care with ventilation support to manage the encephalitis as no specific treatment is available. Control of the Nipah virus in Malaysia was dependent on the initiation of strict quarantine procedures and the slaughter of all swine from affected facilities. The best way to prevent Nipah virus infection is to avoid contact with infected bats and pigs. Other preventive measures include practicing good hygiene, wearing personal protective equipment when working with pigs, cooking pork thoroughly, avoiding contact with bats and their droppings. Nipah virus infection is a serious and potentially deadly disease. It is important to be aware of the risks of infection and to take steps to protect yourself and your animals.